Hello, my name is Alison and I am one of the physiotherapists at Velindre Cancer Centre. We have put together this short video on managing breathlessness at home during this uncertain time. Breathlessness is an unpleasant sensation of uncomfortable, rapid or difficult breathing as your lungs work harder to draw in more oxygen. It may come on suddenly or gradually over a period of time. Breathlessness can be very frightening and distressing, even in milder cases, and may be made worse by fears related to coronavirus. There are many things that can relieve or help you manage breathlessness. Some people prefer some techniques over others. There is no right or wrong way of coping. The most important thing is to find what works best for you in each situation. When trying to manage your breathlessness, it can be useful to consider the 4 P's: prioritise, plan, pace and permission. These can help you conserve energy and cope better with your daily activities. Prioritise. Consider which activities are important to you each day and prioritise the activities for which you would like to conserve your energy. Try to cut out unnecessary tasks in order to conserve your energy and spread out activities in the day. For example, do 5 minutes of ironing 6 times a day instead of 30 minutes at one time. Plan. Organise your activities as effectively as possible in order to conserve as much energy as possible. Try not to do too much in any one day and plan your activities for the week if at all possible. Pace. It is important to balance periods of activity with periods of rest. For example, take your time when walking and take frequent rests if you need to. Permission. Give yourself permission not to do activities which make you breathless and tired. Try and change your way of thinking. Instead of I must or I ought, try I choose to do or I wish to do instead. For example, I should ring Sam to I could ring Sam. Some people find that certain positions can help ease their breathlessness. Here are some examples that you can try for yourself. Practice them and find which one works best for you. High side lying. This position will help take pressure off the chest. Lie on your side in bed. Head and chest are supported by the arm and pillows. Top leg is bent up. Lower arm is bent under the pillow. Relaxed sitting position. Find an upright chair. Elbows are rested on thighs. Hands and wrists are relaxed. Forward lean standing. Lean forward against a banister or chair. Relax forward slightly, loosening neck, shoulders and arms. Relaxed standing. Lean against a supported wall. Relax forward slightly, loosening neck, shoulders and arms. Do not lean too far forward and fall. Controlled breathing can help you gain control of breathlessness whilst encouraging the body to relax. It uses your diaphragm and lower chest muscles to help you breathe more easily. It can be useful to practice this technique when you are feeling calm and not too breathless, so that it is easier to do when you are feeling more breathless and possibly anxious. To start, sit comfortably on an upright chair with your neck, shoulders and back well supported. Relax your shoulders. Breathe in gently through your nose if you can. Try to use your lower chest to breathe. When you inhale, your tummy area should expand rather than your upper chest. Breathe out slowly and watch your tummy sink back down. Some people find it helpful to breathe out through pursed lips, like blowing out a candle. Continue doing steps 1 to 4 until your breathing is more controlled. It can help to place your hand on your tummy so that you feel the gentle movement of your tummy. The calming hand can be a useful technique to use when feeling breathless, especially if you start to feel anxious and panicky. Work your way through the following steps. Step 1. Thumb. Recognition. Recognise your signs early and take the following steps to regain control. Step 2. Index finger. Sigh out. As you do, relax your shoulders and arms. Step 3. Middle finger. Breathe in slowly through your nose. Step 4. Fourth finger. Breathe out slowly through your mouth. Step 5, little finger. Clench and make a fist. Hold for a few seconds and then relax and feel the release of your hand. This can be repeated until you feel you have gained control of your breathing. Here are some practical tips from the Velindre physiotherapy team to help manage your breathlessness.
Even during this time when you're limited with going out, try to keep as active as possible within your own home or your garden.
We are currently advising you don't use fan therapy for breathlessness, as there is a risk that it can spread infection around the air. So alternatively, we are advising that you use a damp, wet cloth or sponge on the bridge of your nose, on your forehead or on your cheeks to help cool yourself down to aid the breathlessness.
So you might find it easier rearranging your home slightly by placing a chair at the top of the stairs, in a hallway or a landing so you can rest between rooms.
Sit down to do tasks like washing, dressing and preparing food.
Arrange your kitchen so the things that you use often are at waist height.
Keep a phone close by. Tell people who call you often to give you plenty of time to answer. When walking, avoid holding your breath or turning or moving too quickly. Make sure you take your time and rest often.
We hope you have found this video helpful. Please remember, the physiotherapy team in Velindre Cancer Centre are here to help you. If you have any questions for the team, please contact us via email or the number at the end of this video. Thank you and keep safe.